Hey everyone, welcome back. I'm Dr. Rupa, ophthalmologist and lover of all things beauty. And today we are talking about eye makeup and eye surgery. So if you are interested in finding out when you should stop wearing makeup or when you can start wearing makeup after you've had any of your eye surgeries, LASIK, cataract surgery, eyelid surgery, keep watching. So this is a question I get pretty commonly, and it's really interesting because as some of you know, my husband is a cornea specialist and he does cataract surgery as well. And I think the problem is that so many women patients are just kind of nervous to ask their male surgeons about this. And I think it just doesn't come up in the conversation. The men aren't thinking about it. And then they find online chat forums and find ophthalmologists online and they're asking us about eye makeup. So I figured let's address it. But first, before we get started, I would love it if you would like this video, subscribe to my channel, and comment below about the kind of content that you guys want to see. I am happy to produce. All right, so let's get into it. So anytime that you have eye surgery, you really want to stop wearing eye makeup for about 1 week beforehand. And that is LASIK, cataract surgery, pterygium surgery, that's surfer's eye, eyelid lifts, the kind of surgery I do, which is lazy eye surgery, eye muscle surgery. And the reason for that is mascara, eyeliner, eyeshadow, they can all harbor bacteria. And you don't want that bacteria proliferating on your eyelids and on your eyelashes where you're going to actually be having surgery. They have found in study after study that bacteria on your eyelashes can get into the surgical field, even if you don't have surgery on your eyelids themselves and surgery is being done inside the eye, it can still get into the surgical field. So for that reason, to be super conservative, I would recommend stopping all eye makeup for 1 week prior to surgery. Now here's one exception, lash extensions. I know how long lash extensions take to fall out. So unless you want to go to your lash artist and have them removed, which most of the eye surgeons would recommend, I wouldn't do a fill-in for at least 6 weeks before your eye surgery because you want all those extensions out. They are just really the perfect breeding ground for bacteria as well as lash mites. So you don't want any of that in the surgical field. I have known surgeons that have canceled eye surgery because the patient had lash extensions. So you don't want to be one of those patients that shows up for surgery, you've stopped eating after midnight, and you go to the operating room and the surgeon says, sorry, you've got your lash extensions, I'm not touching you. And the only reason is because we want to be safe. You know, the risk of infection or the serious potential complication of endophthalmitis is so rare. However, it is not completely impossible. And that endophthalmitis can leave you blind. So we just want to minimize anything that's going to increase that risk. And wearing eye makeup and doing lash extensions prior to your surgery can increase that risk. I would recommend using Clinique Rinse Off Makeup Remover for removing your eye makeup that week beforehand and even just a couple days before, just to get rid of all of that debris. There's actually been a study that was done with ophthalmologists that found that it was able to get the most makeup off compared to any other makeup remover. So that would be what I would recommend. This is not sponsored by them, but just a recommendation. Now, what about for after eye surgery? Very similar rules apply, and it really depends on the type of eye surgery you have. Now, some surgeons will say it's fine to go ahead and use eye makeup right after. The type of cataract surgery we do nowadays uses such tiny incisions that bacteria really should not get into the wound. My surgery is a little bit more intense. I do eyelid surgeries and eye muscle surgery. So I tell my patients 1 to 2 weeks. If you want to be on the safe side, I would just avoid wearing makeup for 1 to 2 weeks after your surgery. And when you resume, I would buy new makeup. Mascara tubes need to be discarded every 3 months, and they are just really the perfect nidus for harboring bacteria. So again, just be on the safe side. Toss your old mascara, buy a fresh mascara, avoid glittery eyeshadow as well. Glittery eyeshadow tends to have a lot of fallout, and you don't want that falling into the new postoperative field, whether you have incisions here on your eyelid or sutureless cataract surgery or LASIK. You don't want glitter in there. Third, don't tight line or apply eyeliner into your waterline. Keep everything on the skin even when you do resume, just to be on the safe side. Again, you don't want to be introducing debris, particulate matter, or anything with bacteria where it can penetrate and go into the eye and cause a problem. Last, make sure you're using clean makeup brushes when you restart your makeup routine. Wash everything with a nice gentle cleanser. Make sure it's all super clean so that your eyes stay really clean after your surgery. Anyway, hope that was helpful. Nice, short, and sweet regarding makeup and eye surgery. If you have any questions, let me know. And thank you guys so much for watching. I am Dr. Rupa, and I will see you soon. Mahalo.
So guys, I just wanted to tell you, subscribe to our channel and comment down below. Do all those things. Push the bell button. I also wanted to talk to you about, also check out my mom's videos. They're really good. Also, she's gonna do like a lot more stuff because she has to edit more humongous stuff. So make sure you check it out because it's gonna be really good. You'll give it 100 thumbs up.